I'll be discussing Medicare Plan F high deductible, so stay tuned. I'm Keith Armbrecht, founder of MedSup Savings. I hope you'll find the information in this video very helpful and presented in an easy to understand format. Turning Medicare eligible is actually a very good thing. You'll likely find Medicare to be a much better alternative for your health insurance needs than what you may have had previously. But there are some choices. So I've created a Medicare Resource Center where I have a complete video library on everything Medicare. You'll also find all the necessary links and the guides and the forms that go along with them. So please, after this video, take just a few minutes to explore our Resource Center. You'll likely find everything that you need for Medicare. You can also get an immediate quote for your Medicare Supplement insurance. Just fill out your basic information and it will provide the rates for the plans that are available in your area. It would also be a really good idea to subscribe to my YouTube channel. That way you'll always have access to my videos and you'll get updates as they come along. So again, I hope you find this information very helpful, and please let me know if I can help.
Okay, now we're going to talk about Medicare Plan FHD and when you should consider choosing Medicare Plan FHD. And I can tell you, it's pretty simple and it really goes by where you're located. So in a couple of states, Plan FHD makes a tremendous amount of sense. So I want to make sure you understand it so that way you can make the best decision when you choose your Medicare Supplement Plan. So I'm going to go through, I'm going to show you exactly where, I'm going to show you why, and I'm going to show you exactly how and what the difference is between F and FHD and really the others. So if you recall, if you've seen some of my other videos, these are our choices for Medicare Supplement Plans. We have about 10 choices, really 11. If you look right next to F, there's this asterisk, and that asterisk is Plan FHD. I have no idea why they try to hide it, but it certainly seems that they do. But again, if you live in a certain area, FHD makes a lot of sense for your Medicare Supplement Plan. So what is the difference between FHD and the rest of them? I'm going to show you that. And where might you take a look at it? And I can tell you, primarily in Florida and in New York, makes a tremendous amount of sense to consider, not only to consider FHD, but to probably choose FHD. So I'm going to show you exactly why. So what is the difference between Plan F and Plan FHD? So here we have it. Pretty easy to understand. Now, if you've seen my other videos, I absolutely do not recommend in any case that you choose Plan F. But in this scenario, I want to give you kind of an apples to apples comparison so you can understand exactly the difference between the two. But G is almost always a better value than F, but it's easier to compare FHD to F because you'll see it makes a lot of sense. So Plan F, we know 100% coverage. It basically covers what Medicare does not on the medical side, on the doctor side and the hospital side. There is no deductible. So you basically have no out-of-pocket expense during the year if you have Plan F. If you recall, Plan G, your only out-of-pocket expense is $183. So that's a whole nother story. You can watch that video. But if you're in New York or Florida, even Connecticut, sometimes Washington State, sometimes California, and maybe just give me a call and we'll walk through it and make sure if you're in those areas, we'll make sure that if it is the right choice, you understand it completely. But the difference between FHD and F is the deductible. So FHD, the HD stands for high deductible. So there is a $2,200 deductible on Plan FHD. Why would we ever want a $2,200 deductible on our Plan F? Quite simply, it brings your premium down dramatically. In some cases, it brings your premium down more than $2,200 for the year. So if you save $2,200 in premium to take on a $2,200 deductible, it's just a no-brainer. So, I mean, it's one of the easiest decisions that I've seen, and most people just get a little confused by it, so they get a little scared. But I'm going to show you exactly how it functions. So let's take a look at some areas And I'm going to show some Florida, and I'm going to show some New York. And this is where it makes the most sense. And then in other places, it makes a lot of sense. So, again, just give me a call and we'll walk through where you are and we'll make sure that we take a close look at it. So here we have Miami, and I'm going to use zip code 33125. I'm going to use a 68-year-old male. Now, and this is non-smoking, so no tobacco. Now, if we change that a little bit, the numbers might go up a little or down a little older, a little younger, but the difference is going to be the same. So it's all relative. So we're just using this kind of as a framework. So this 68-year-old male may be coming off a group plan, so he may not have come into Medicare at 65, and at 68 he's coming off his group plan. Now he's going into Medicare, or may already be in Medicare, maybe sitting on Plan F right now in Miami and going to see this video and go, wow, I got to change. And it is quite astounding, the difference in cost. So let's look on the left. Plan F, zero deductible. We know that. Pays 100% out of pocket. No big deal. $284 a month for that Plan F in Miami. And I'm using United Healthcare for my framework here. And that's the AARP plan. And that's a whole nother story. If you don't know the full story on AARP plans, give me a call because I need to explain that to you as well. There's some discount in there that goes away later, which is just a whole nother story. So he's paying $34.08 a year for that Plan F. Go over and look at Plan FHD. $2,200 deductible. We know, bam, big deductible. But look at the premium. It's $81 a month. So there's $972 annually. So we have a difference here of $24.36. It leaves me speechless. So we will save $24.36 in premium to take on a $2,200 deductible. Now, what does that mean? That means that no matter what, we're going to come out ahead big time. So on Plan F here in Miami, no matter what, every single year, this gentleman is going to pay $3,408 in premium to United Healthcare. United Healthcare, premium, premium, premium. If he has Plan FHD, it's going to cost $81 a month. And what's going to happen with the difference in premium, he's going to pay himself. So you pay yourself month after month after month. And God forbid, if you had a catastrophic event and you reached that $2,200 deductible, you've already got the money saved. If you do not, that money is yours to keep. So it makes, there's absolutely no sense in the world here to be on regular Plan F. Now, understand how it works from the Medicare standpoint. So on the doctor side, Medicare pays 80%. You're responsible for 20%. So you would pay 20%. So if you go to the doctor and it's a $100 office visit, which it's not likely to be that high, Medicare is going to pay $80. You're going to pay $20. If your $20 co-insurance ever reaches $2,200, then FHD is going to pay 100% thereafter. Where you have the potential of running into your deductible is if you're admitted into the hospital. So you have the hospital copay, which would fall under your deductible, and for 2017, it is $1,316. So if you go to the hospital, you would have an initial $1,316, which, if you had done this correctly, paid your $81 a month, put the rest of it aside in an account, you'll have it there to pay your hospital co-pay. Now, that's really about the only way you're ever going to get anywhere near that $2,200 deductible. So just keep in mind, the difference here is paying an insurance company or paying yourself. And when you pay yourself, if you need it, you've already got it. If you don't need it, then you keep it. So year after year after year, you're going to save a tremendous amount of money. So let's look a little different. Let's look in Tampa. So Tampa, same scenario on Plan F, we know that. But in Tampa, the premium's a little bit less than it is in Miami. So it's only $200 a month for that Plan F. And Plan FHD, also a little bit cheaper in Tampa than it is in Miami, $61 a month. So here we have $1,668 worth of savings to have a $2,200 deductible. And kind of the best way for me to explain it is if you had a $2,200 exposure, whatever that exposure is. Let's say you had an automobile that was worth $2,200 and you wanted collision coverage on it in case you ran it into a tree, and that they would pay you $2,200 if you ran it into a tree. Would you pay $1,668 for that insurance coverage on that $2,200 vehicle? Of course not. That's absolutely ridiculous. So here we save $1,600 and $68 in premium to take on a $2,200 deductible. Now, what I like to try and kind of relate to people is where I think FHD makes the most sense is if there's at least a $1,300 difference in premium. So if there's $1,300 less in premium, I mean, it really could be less than that, but $1,300 is kind of a good line to just kind of understand where you are. Then it makes sense to take on that kind of deductible. Now, I fully understand that some folks just aren't comfortable with the fact that they're going to be able to manage the premium savings and put it aside and have it when they need it, if they need it. So that's something to consider also, is your tolerance and your ability to kind of manage this. But, you know, it's just, I try to bring value where we can have value. So let's go to Boca Raton. It gets better in Boca Raton. So here you have the same Plan F, obviously zero deductible. Premium on Plan F is $284, $34.08 annual. FHD, you have that $2,200 deductible, $75 a month for FHD, $25.08 less in premium. To take a $2,200 deductible, where does this not make any sense? So if you are in Florida, Boca, Miami, Tampa, it doesn't really matter, you likely should be on Plan FHD. So please just give me a call. I'll run all the numbers for you. We'll figure it out if it is the best avenue for you. And if it is, it's very easy for us to kind of make that change for you. Now, keep in mind, if you're already in Medicare, you have to get through medical underwriting. So you got to be healthy in order to change once you're in Medicare. If you're new to Medicare, you can pick whatever you want and they can't say no. So now is the time, if you're new, to pick the right plan to make sure that you get what you want, because later it gets a little more challenging to do something that you might want to do. So let's go to New York, New Rochelle, New York, 10801. We have a 65-year-old female, and you can see Plan F, zero deductible, $269.50 a month in premium. Again, AARP, United Healthcare, $32.34 annual. Plan FHD, $2,200 deductible, $64 a month in premium. $64 a month, $768 an annual, $24.66 difference in premium for a $2,200 deductible. You know, I can't pound it into people's heads any clearer than that in New Rochelle, New York, you have makes 0 sense to be on Plan F, makes just all the sense in the world to be on Plan FHD. Now, why do you not hear too much about Plan FHD? Number one, they hide it. And that, I don't know why Medicare kind of hides it. Number two, agents don't necessarily understand it because it's hidden, so they don't ever see it. And if they're not specializing in Medicare supplement plans, then they probably haven't gone far enough to take a serious look at it. Number three, $64 a month. How much money do you think an insurance agent makes selling you a policy that's $64 a month? Would you think they probably make a whole lot more money selling you a policy that's $269 a month? Of course they do. They make a percentage of the premium, as I do. So that is how most insurance agents work. They can't afford to sell you FHD. So I'm happy to do it. I'm happy to do what's right for you. And if you watch my other videos, you'll see that's my primary goal. Whatever your situation is, let's do the right thing for you. So, and it can be a little complex. So obviously in New York, in Florida, FHD is a no-brainer. In Connecticut, pretty much same thing. So Connecticut's pretty similar to New York, and I don't necessarily know the reasoning behind why the supplement premiums are so high, but FHD does not follow along, but we don't care. It makes all the sense. It's in our benefit. Again, in Washington State, sometimes, California, sometimes, just depends on your area within those specific states. So I'm happy to help you with any of this. And obviously that's how I make my living, is whichever Medicare supplement we choose. It doesn't matter whether it's G or FHD. It wouldn't matter if F, because I would never let you take F. Or N, doesn't make any difference. Doesn't make any difference which insurance carrier, whether it's Aetna, Cigna, Mutual of Omaha, United Healthcare, Transamerica. It doesn't make any difference. Whichever plan we determine is right for you, whichever insurance carrier is right for you, they pay me a little bit to act as your service agent, not only now, but in the future. So I would be with you in the future when scenarios arise, questions arise, whatever it may be. I'm there to help you now and also in the future. So I would certainly appreciate if you would allow me to help. That's how I make my living. And this is what I do all day long. I do nothing but Medicare supplement. So I'm happy to help make sure that we put you in the right place right from the beginning. So if I can help, please just give me a call and I'm happy to do that. And make sure you visit my site. I have many videos on just about everything Medicare. You can run a quote on your supplement plans right on my site. Although I don't show FHD on my quoting engine just because it kind of can throw people for a loop sometimes if they don't fully understand it. So I like to talk about it with them to make sure you understand it. And then whichever is the best decision is the best way to go. So I'm happy to help with any of it. And I hope you have a fantastic day.